The research process, characteristics and requirements. What are the different characteristics of research? The very first one is research should be controlled. You need to plan your study or research in a way that minimizes the effects of other factors which can affect the relationship. It is difficult to control and minimize the effect of these different factors, or they are called as the confounding factors or variable, which compete with the exposure of the interest, treatment plan, or anything in expanding the outcome of study. Which these are the factors which actually which can disturb your study. You know, like you don't want to work in an environment which is not controlled. Like in biomedical sciences, if you're working on some animal mice model, so it is advisable to go to use the mice of the same age, sex, or weight of the mice. It's not advisable that you are going to test a new medicine, new therapeutic some ingredient on an infected mice. And on one hand you have a mice, you have, let's say, 5 mice whose weight is or whose age is about 8 to 10 weeks, and you have got 5 mice who have, or 7 mice who, which are about 20 weeks old. Their weight might be different, their ages and their sexes should be the same. So it's not advisable to work on a system which is not controlled. So very first, most important thing, especially in biomedical sciences, is to get a controlled environment for the research. Research should be rigorous. It means that the procedure that are being followed to find out the questions, the methodology, the protocol uh, that you are working on, that should be relevant, appropriate, and justified. Research should be systematic. The procedure that you have adopted to find answers to certain query, they should follow a certain logical sequence. The different steps cannot be taken in a haphazard way. Like, it's not as advisable you directly go for molecular analysis of something. Let's say you've got some bacteria, so ideally what we do is you just go for some gram staining, you look at the colony morphology of the bacteria, then you do some other biochemical characteristic, biochemical identifications, and if you feel, then you go for molecular confirmation. And these are the logical sequences of steps, no? So you need to uh, go with systematic steps. Some other characteristics of the research include research should be valid and verifiable. So that's very important, that whatever you conclude on the basis of your finding, it should be correct and it can be verified by you and some other. It's not that you are the last one person in the whole world who has done some research, who has done some steps, and they cannot be replicable, they cannot be repeated. Research should be empirical. That's very important. Any conclusion that you write, this is very much specific, they're very much important in biomedical sciences. We will be coming towards that in a few slides later on. So that the conclusions that are being drawn from a research, they should be based on information which is gathered from real life experiences or observations. It's not something, out of this world. You present a phenomena which is absolutely out of this world. You say that, let's say, smoking can cause UTI, urinary tract infections, although we are fully aware that it can lead to lung cancer, and it affects the lungs. So the research should be based on real life events, real life, and the conclusions that are drawn, they should not be contradicting the everyday experiences. Research should be critical. That is the precise interpretation of the finding. The process of investigation must be foolproof and free from any drawbacks. That's very much necessary. The process adopted and procedure used must be able to withstand critical scrutiny. If persons want to scrutinize your study, he should be able to do it because you have used valid procedure, valid protocols for that.